biopsy, they can usually get all of it with a biopsy. And a biopsy, you can do that in the doctor's office. That gives you the extreme. One treatment you can do in the doctor's office, you can usually go home. The other treatment, you're in the hospital, surgery, and you're going to have some treatments afterwards, which is a more long-term and much more expensive option.
Right.
When you have the Men's Health Expo, do you have experts from all of the fields that pertain to men's health, and then men can come in and ask their questions and have their comments heard?
Yes, it's going to be on September the 11th at the Martin Luther King Center in Gainesville.
Okay.
And it's going to start at 9 a.m. to 2 p.m. We have they call it the mobile clinic. And it's like it's similar to a blood mobile, but they're able to do exams in there. So they're going to be doing the prostate exam screenings and also blood tests. Then we're going to also have blood pressures. We're going to have speakers that's going to come and talk like first thing on prostate cancer and talk to the men about it. And then we're going to have a variety of health issues that's related to men.
And is this all at no charge?
No charge.
Oh, that's
no
wonderful.
Charge. And we're going to have some people that are coming, because you know we have some in the rural communities. So we're trying to coordinate like bus or van, bringing people in, because a lot of times our smaller communities don't have access to free stuff. You know, they might have a clinic there, but they don't oftentimes have access to free stuff.
Okay. Well, we're here to help you. We want to get the word out about good things like this. So we'll pay attention to what you're saying now. We'll take notes, and then we will continue making sure the message gets out there from now till then. So tell me the date and the place again.
It's September the 11th.
Okay, that's an easy date to remember.
Yeah, 911. It's going to be at the Gainesville Martin Luther King Center.
And where is that exactly?
That's on Waldo Road.
Waldo Road, okay.
Right off of Waldo Road and 8th Avenue, and I do not have the specific address, but most people know the Martin Luther King Center there.
Right.
It starts at 9 a.m. and it ends at 2 p.m. And at 9, we'll do the check-in and registration, just getting, everybody signed in. And then about 9:30, we'll have a physician that's going to talk on prostate cancer, and then also answer questions. Have a question and answer session.
Oh, why are you so active in the health field?
Well, initially with being a clinical laboratory technologist, I knew I just didn't want to be inside the lab. I knew that like right away. And I'm originally from Jacksonville, and one of the first things I did early on in my career, I used to work with St. Vincent's Hospital, and they had what we call a wellness wagon, similar to a blood mobile, but we would go out and do cholesterols. We do your we do your lipid, cholesterol, HDL, LDL. We do your glucose, and we do triglycerides. And so it was kind of like having a little mini screening test, and then we would also do blood pressures. And we would go to colleges, we'd go to gyms, we'd go to senior citizens' homes, we'd go to the mall, and then I knew I liked being in the community. So really, community health education started there.
Yeah, right. It sounds like it.
Yeah,
you just had a passion for getting the word out and being one-on-one with people, kind of like you're doing right now with us. And just spreading the word.
Yeah, and we even, when I initially moved to Gainesville in '90, that same company came to Gainesville because we went to St. Mary's, Georgia, and there's an Army base there, and they were having a big health fair for the men. So we brought our wellness wagon there, and we participated and did their screenings, and it was a very good experience. So I actually say in '87, that's when I really started doing community health education.
You bet, that's a long time.
Yeah, and
you don't look old enough to be doing that.
No.
Yeah, this year is my 25th year as being a clinical laboratory technologist. Yeah.
Wow.
Yeah.
So good healthy practices pay off, huh?
Well, I try to, you got to keep it together.
So at the men's health thing that you're doing in September 11th, you want to do something to attract men.
Yes.
Have you thought of pong beer? Have you tried beer pong? What's that thing called? You know, where you bounce the ping pong ball and try to get it into the cup of beer?
Yes.
They're still working on like the activities.
Well, that one would work. That would work. That would help. Yeah.
We're trying to get. There's a prostate cancer foundation, and there's a musician. He's an R&B musician back in the 60s and 70s, Charlie Wilson. So we're trying to see if we can get him to.
No, it's not going to work. It's not going to work. No. Let me help you out here. No, no. He might be a very good musician, but he's not going to get the men to come in.
Oh, okay.
No. Who does she need to come in?
Winghouse girls.
That would work. I think that would work. I was trying to think in the lines of a singer.
Oh, I see.
Yeah.
A lady singer. I don't know who's singing. Who's popular right now? Beyonce? Yeah, Beyonce.
Yeah.
Yeah. And then the men will show up.
Yeah.
Yeah, we'll get all of them coming.
Oh, when you go and
I'll have my prostate check for her.
When you go and do your talks and things and your presentations at men's clubs, how do you keep them from being uncomfortable talking about this? Because this is it's private.
Yeah. Well, for me, first of all, my personality, I come in and I just open up with, hey, this is who I am.
Are you putting on a glove while you're saying that?
No.
Snapping the edge of it?
No.
Hey, how you doing here, mister? What's your name?
Yeah, but you got great fingernails, too. So also.
No, I come in and I make myself, what I would call make myself at home, and I talk about a variety of topics. And one of the men's groups that I go to regularly is the fraternities. And they usually have like their conference or conventions. And so I come in and I find out what they want to hear about, and then I cater it to them, and then I engage them. I don't just do the whole presentation and everybody's just listening. My first opening statement is, who has already had an annual physical? And so that's going to open up a whole conversation, because if I have a room of 100 men and I only see 20 raise their hand, then we're going to talk about, okay.
So what is it they all want to know?
Well, one topic that's very popular is the blood pressure. Because a lot of times our men, they'll get their blood pressure checked. They've been told that it's elevated, and then they kind of say, well, let me just wait on it and see about it. And then, they're supposed to come back for a follow-up checkup, and a lot of times they don't. Because, men sometimes say that women have their own little talking groups. Men have their talking groups, too. Sometimes they get information about the medication that they may have to take and what the side effects are, and they may not feel comfortable with the side effects. And what I try to educate them on is that we have so many medications now for blood pressure. If a medication that you're taking gives you side effects that you're not happy with, talk to your primary care physician about it. They can change it, because we have so much technology now and so many medications that if one doesn't work, that's not the only one. We got tons of them.
Does anybody ever go or insist on going the holistic approach or the herbal approach? And what do you think about that whole avenue?
Sometimes they do, and some things do work. What I always do tell them is to let their physician know whatever vitamins or treatments that they're taking, because sometimes the Western medicine and some of the vitamins or minerals or herbs that you take, sometimes they can counteract each other. So the physician needs to know, if you are doing something else. And there are options. There's meditation, massage. There are some herbs that, some people, say that they can use, and it does different things. And so what I just do is just, tell them it's not that you can't do those things. It's just let your physician know.
Yeah,
and
right.
now our Western physicians are, coming around to some holistic treatments, especially massage. Relaxation techniques, and it's best to take vitamins. There are some vitamins that, a multivitamin is a good thing to take.
And it seems that by being open like you are in your personality, that you are quelling whatever fears that they have, because sometimes fears can override common sense.
Yes, because I would say, of all the concerns